Thanks so much for having African Mothers Health Initiative and me, and happy holidays, happy new year to all of you. Um, I am Genevieve Gradman. I'm a longtime Tacoma, DC and Tacoma Park resident, and I am also the longtime treasurer of African Mothers Health Initiative. We are a 501c3 organization that has been in existence for about 12 years, and we provide mom and baby care to critically ill postpartum mothers and babies in Malawi, which is a country in Africa. I'm particularly devoted to AMHI because I had a catastrophic childbirth of very sick twins about 5 years ago. And fortunately, I survived that childbirth, as did my twins. But I stopped counting the medical bills when they exceeded $1 million. In Malawi, maternal and infant mortality rates are among the highest in the world, and hospitals and clinics are severely understaffed there. This means that if you have a birth of a twin or a triplet, and they're very high in Malawi, the majority of those children die. And of those children that die, they generally die in the first year and even in the first month after birth. Women, too, often die in childbirth. I believe there's like a 1 in 10 chance, lifetime chance, that you will die in childbirth in Malawi because critically ill women and children cannot reach facilities in time to save their lives. So we are a small, person of color, women-led organization. We have no paid employees in the United States. We hire nurse midwives, Malawian nurse midwives, who understand their communities the best, and we provide home-based nursing care in the cultural context of the communities served in Malawi, such that 95% of the women and children we serve survive. We have three gifts that we are offering today, and through the 31st of December, I'm excited to hear, through AGGW. The first, I'm going to start with our $30 gift, is 2 visits to a mom or baby by a nurse midwife in Malawi. We will follow a critically ill mom or baby to their home and provide nursing care for the baby for the first 2 years of that baby's life, and for the mother for the first 6 months postpartum after a catastrophic childbirth. The second gift, at our $15 level, is a supplemental food package to a breastfeeding mom. Of course, the people we serve in Malawi are subsistence farmers. They don't have 2 cents to rub together. They live in earth-made huts with dirt floors, and they have no money whatsoever to purchase formula. So in so much as if the mother survives childbirth, if we can feed her enough, the hope is she can produce enough breast milk to care for her child. So we provide supplemental food packages for our nursing mothers who have survived childbirth, such that they're able to nurse their critically ill newborns or multiples. The last gift I'd like to describe to you and would ask for your support for is a month's supply of formula for an orphaned infant. The question we get over and over and over at every gift fair that I ever have participated in over the past decade is, why would you buy formula? And the answer is, if the mother is dead, there is no other way to feed the baby. Our number one cost, other than transportation to get our nurse midwives to our patients in need, is for formula for orphaned children. And it's not just the formula that makes the difference, it's that we send a nurse midwife to the community. We teach the caregivers how to prepare the formula. We teach them to boil the water, to take the little cup, to drip it in the baby's mouth, such that the child lives. The alternative of no formula is unfortunately a non-living child. So the way we're able to achieve a 95% survival rate with our babies is that we are able to feed them when there is no other alternative. I'd also note that HIV prevalence in Malawi is very high, so wet nursing is not unfortunately available to us, nor is milk banking due to the lack of electricity. So the last gift is our $65 level of a month's supply for a formula for an orphaned infant. So those are our three gifts. That describes a little bit about how our methodology, it's not just giving people something, it's working in context with the community and with a Malawian nurse who knows her community the best to help save moms and babies who otherwise would not survive. Because there, but for the grace of God, go I, and perhaps many others like me. Thank you so much.